Hi guys, Griselda Lopez here. I wanted to go ahead and take this time that I'm home to do a quick video, and I may do a few more. I haven't really decided, but let's talk flossing. Okay, so flossing really comes down to what's known as interdental care. Okay, interdental means in between the teeth. And sometimes you can achieve that without necessarily using your traditional floss that we all know of. Okay, so you guys all know your typical floss here, and there's all sorts of different floss out there, so we're going to kind of go over everything, but let's start with the purpose of why we do it. So the purpose of why we go ahead and floss is to remove any plaque or biofilm that's between these interdental spaces. Okay, that's why they call it interdental plaque removal. So when you're talking about interdental spaces, you're talking about the spaces between the teeth. And everybody's spaces are going to be different. And as a matter of fact, the teeth in the back are a little bit different sometimes than your teeth in the front. Now, the interdental spaces might be different everywhere in your mouth. So that's why there's different ways to get in there, in between, and clean them. So we'll start with the basic. Okay, so you have your interdental anatomy, which is they're called embrasure spaces, and there's different types of embrasure spaces. So let me show you what I'm talking about. Okay, I'm going to pull out my dental hygiene book. So you have your interdental embrasure space 1. Okay, that means the papilla between those teeth goes right up against those teeth. It's nice and snug. There's no real space. Okay, then you have your type 2, which means that there's actually a little bit more space between them. You can kind of see between those teeth there. And then you have your interdental type 3. Okay, this is your embrasure space type 3. And this is usually for people, you'll see people with this who have recession or who have had periodontal disease. Depending on your type of space is going to depend on what type of product you want to use to get in there and clean in between those spaces. So you have your traditional floss that you can use to go in between the teeth. And I didn't cut this. This one is a little bit more, it's got like a bounce to it. Okay, it almost reminds me of a rubber band. And you want to go between your teeth here, and you want to make sure you slide down. As you can see, right in between here, that's probably not the best spot to show you guys because there is a fairly large space there. Okay, so floss is not going to be the best thing to use there. You're going to want to use floss for where there's tight embrasure spaces, like back here. Okay, and you want to go and glide it on one side and kind of glide it on the other, and then come back up. Okay, that's essentially what you want to do to floss. You don't want to ever pull it straight down because it'll actually hurt the tissue and you can cut the tissue there. So you want to make sure that you're going to the side and in between. Okay, get the space between the tooth and the gum tissue. That's your periodontal pocket. Okay, that is that when they're checking your gums, you know, when you go to get your dental cleaning done and you hear them call out, you know, 1, 2, 3, 1, 2, 3, 2, 3, 4, 4, 3, 5, you know, those numbers, that's the space that they're getting. And usually what I tell patients is we're going to go ahead and check your periodontal pockets. We're going to check the space between your tooth and the gum where popcorn kernels get stuck. Most people have had a piece of popcorn kernel get stuck in that space. So that space should be between 1, 2, or 3 millimeters, okay, to be considered healthy. And the reason why we say that is because your toothbrush and your floss reaches down to 3 millimeter pockets. So anything deeper than that, you want to use something else than just floss to get down in those spaces to clean. Okay, let's talk about the different types of floss. Okay, you have your regular floss. This is a thinner floss. You have floss that is waxed, and you have floss that, you know, is different flavors, different colors. you have floss that is like kind of sewn together on itself, and you have like a woven floss, expandable floss. Personally, I like this floss here. You can see that it's in color. It's not your traditional white floss, it's black. It is expandable. It is infused with charcoal to help remove stains and to help kill, like an antibacterial type of thing. So it helps kill the bacteria. But I like it because when the floss gets wet, which is when it gets in your mouth, it'll expand and it'll go in between these little spaces that we just talked about, right? These little embrasure spaces. So if it expands, it's going to be able to actually fill that whole space. So if we go back to the model, remember that those front teeth? This floss isn't going to do it, right? It's not going to do it for this. That space is too wide. It's not going to do anything for that. It's great for the back ones. But even this one, so if I flip it like this, you can actually kind of see these spaces between these teeth here. And I'm trying to see if I can get it to focus. Anyway, so you can see the spaces here. So this floss, once it's wet, will actually expand. And they'll fill that whole space in there so that it's going to remove more plaque and bacteria. Alright, that's one way. You have your traditional floss. Then you have these things here. This is called a proxa brush. Okay, and the way this works is it comes in two separate pieces. You have the handle. Let me try to separate it. And then you have the actual little brush itself, and they get sold in a different little package, so you have extras. Okay, but you put it right in this tiny little hole here. And you close it up like that, and now you're ready. And this works really, really well because it has a long handle. So it's good for the areas in the back, especially when you can't reach back there, to get in there and go in between those teeth. Now on this model, this tissue is not going to move because it's got no tissue, okay? But you should be able to essentially go between those teeth in there, okay? And I will say there's different thicknesses in these, so depending on where you're going to use it, you might have to get a different thickness. But here, we'll try it here on these front teeth, and you can see. So here's on those front teeth, and you can actually see how it cleans all in between those teeth, which floss doesn't do that. So I think of it kind of like a bottle brushes for any of those people who have kids. You probably know what I'm talking about. But it goes right in between those spaces, and it gets both sides of these teeth at the same time. And it gets in between those embrasure spaces that we were talking about. And this you could probably use a couple times. I wouldn't say more than 2 or 3 times, because these are going to start to fray on you and they're not going to work as well. And you just switch it out. Or they also have these proxy brushes that come in this tiny little handle. These are disposable. Again, they come in different thicknesses. I actually recommend these all the time, and I like that you can bend them. You just got to be careful, make sure it's a good one, because I don't want you to go in there and start cleaning and then it breaks on you, okay? But here you go, right here. Here we go. I'm trying to adjust this, guys. I'm sorry. So, and see, this is thinner, so it's gonna fit in more spots than the other one did. And they come again in different sizes. These are called proxa brushes. I call them proxy brushes. You can find them in any store. They come in, different sizes. You can find them in packs of just one size or different sizes, different thicknesses, depending on those embrasure spaces, okay? So I usually tell patients to get maybe a variety pack, one that has a little bit of everything, and you can see which one you need, so then you can just get the pack with that one size. For my people who have braces, my son is currently in braces. He actually, you can use these proxy brushes to go underneath the wire really well. Also have the option, these soft picks here. So these are a little bit, where are you? You can see it has these tiny little things here that go on the outside. They're supposed to clean really well. It's just a different option. And this is so blurry. And you can go right in between those teeth and in between those embrasure spaces. And these are disposable, guys, so this is a one-time use and then you throw it out. These are a little bit more flexible because they are plastic than the other ones. Since we're discussing about patients with braces, let's talk about the floss threaders, okay? There's different types of floss threaders. There's the ones that are individual, like this. Okay, and what you do is you take your floss and you thread it through like you're threading a needle and a thread. And this doesn't have a bracket, but you essentially go underneath the wire, pull it through, and then you're able to floss between the teeth with it. And you have to do that between every tooth, underneath the wire. Alright, so this is a floss threader. You can find these in any store in the toothbrush aisle there with the floss. And then you have the floss threaders that are already attached to your thread. I prefer using these when I have a patient with braces because the tip is already attached to the floss, and then this piece of floss right here is like an expandable piece of floss, so it gets in between those spaces a lot better. I like to use these when I'm doing my dental cleanings on patients with brackets. This is what I prefer. That's not my preference. Now let's talk about these little flossers. Okay, I know a lot of people use them. These are specifically for kids just because they aim them for kids because they're colorful, but adults could use this. Anybody can use this except for people with braces. People with braces have to use one called the platypus. That's specifically designed to go around the brackets. This one here, the thing with these is you have to remember it's one piece of floss. It's this tiny little piece of floss you're using for your whole mouth. Okay, and the reason why we recommend that you do a big piece of floss when you floss is because you're not supposed to be using the same piece of floss on every tooth, because if you have a cavity, for example, that has specific type of bacteria on it, okay? And you are spreading that from tooth to tooth to tooth to tooth to tooth. Unless you are taking that piece, let's go back to this. Unless you're taking this and you're running it under the water faucet between each time that you're flossing between each tooth. So you floss here, you go up against the tooth, you go up against the tooth, you rinse it underwater, and you go to the next tooth. Up against that tooth, up against that tooth, slide it out, rinse it out. Okay, so unless you're doing that, you are inoculating the other teeth with whatever bacteria is there. Okay, and your food for thought is, well, it's one mouth, right? Why would I care? But again, if you have a cavity in one spot, that has a specific type of bacteria and biofilm, and you are now spreading that and inoculating other teeth with it. when you use this. This is great for when you're on the run. If you know that you get a lot of food stuck in a specific spot and you know you're going to go out to eat, you can put some of these in your purse, in your pocket. And when you're done eating, you go to the restroom and you quickly get in between that spot, throw this baby away. What I don't want you to do is try to use this numerous times. Like this one little piece, use it for a week. Don't do that. That's gross. And it's not going to clean as well. This is going to start to deteriorate after you use this. This piece of floss is going to be compromised. It's not going to clean as well. Okay? It's reusable for a reason. Use it once, throw it away. Okay? This here is a gum stimulator. Okay? This is good for the areas where, let's say you have a little piece of tissue that's really enlarged in one spot. You take this, you walk it around the gum tissue along the tooth, and you stimulate your gums. You're essentially giving your gums a massage. Okay. This here is called the tuft end brush. It's a little triangular, and it has this long handle. And you can use this. This is good to use along the gingival margin or along the gum line. So like up here, especially if you have brackets, you can go up here and just kind of brush along that gum line. Maybe you have a spot that you have gum recession on that you don't want to scrub too hard on. You just take this and right along that gum line, and you just scrub that baby nice and gentle, smooth circles, okay? But it's good for areas like this. If you have a space or you're missing a tooth and you just want to go in there and clean it out. Like, how's the best way to show y'all this? Here we go. This might be it. So right in here. And you could just go in there and you can clean it. And this is good for these lower anterior teeth here, because you all know stuff gets stuck in there all the time, right? Stuff gets stuck in there constantly. And you have these nice triangular embrasure spaces. This is great for that, because it goes in there and cleans it out. Now, when it doesn't matter what you get, if you want it to be soft. Okay, you don't want one that's going to be too hard because you don't want to damage your gum tissue. So make sure it's really soft. Last but not least, I want to talk to you guys about a water pick, because a water pick is another option, okay? If you go to your dental appointment and they say, hey, you know, you really got to make sure that you're watching this area. We're having a lot of bleeding. You have some active gingivitis or periodontal disease in that area. Any kind of floss isn't going to work back there, okay? You're going to want something that's going to reach down to the base of that pocket, okay? And what I said from the beginning is healthy pockets are considered 1, 2, or 3 millimeters in depth, okay? 1, 2, or 3 millimeters. That's considered healthy. 4 millimeter pockets is considered gingivitis. Your floss can't reach that. 5 millimeter pockets and up is considered active periodontal disease. And you have different stages within that, okay? But it's considered active periodontal disease. There's no way that your toothbrush or your floss is going to reach that. These brushes work really well to get into those pockets. So let's take this model, for example. And let's say you had a pocket back here. You can actually take this and you can go down to the base of that pocket and come back up. And you're actually actively cleaning that space, those millimeters that they discussed with you. Okay, so these work great for that, especially the ones with the long handles, because it gives you access to go and reach back in those areas to get to the bases of those pockets, okay? You can dip it in a little bit of mouthwash. You can even ask your dental professional to give you a prescription mouthwash, so you can just dip a little bit in there and go back in there and get in there and get to the base of those pockets. But back to the water pick. I personally like this Aquarius model. Okay, this is mine. It's probably a little dirty. I try to wipe it a little bit, but this is actually ours. This is what I use. This is what my son uses. He's in active braces. The reason why I like the water pick, first of all, you want a water pick brand. Okay, you want something that's got the ADA backing. Not all water picks are the same. Okay, I like this model because of this right here. Alright, this button right here is going to be a lifesaver. You fill it up with warm water. Don't fill it up with cold water, because if you have any recession, you're going to get sensitivity. So fill it up with warm water. Put a cap full of mouthwash in here, okay, and fill the rest up with warm water. It's plugged in. It plugs into the wall. Okay. I always tell patients to start somewhere in the middle. When you're starting, start somewhere between 6 and 8. Okay, this is PSI. It goes from 10 to 100 PSI. You can start at the bottom if you want. I wouldn't recommend that because patients think that they're starting here and they tend to stay here and they're not really getting anything out. So I always say start in the middle and slowly work your way up. Now, working your way up slowly might take you a few months or even up to a year before you get to that, and that's okay. You're going to turn it on, and you're going to start to hear this thing going off, okay? As long as you have this button on off, then nothing is going to come out of here. If you have this, there's a model that has a button that you push it in and it pauses the water from coming everywhere, but you have to hold it down. If you don't hold it down, you're going to get water everywhere, and patients hate water picks because they're messy. And they're not messy if you know how to use them. It comes with different tips. There are multiple of these regular tips. These are your regular tip. There's different colors on them so that you can distinguish whose is whose. Okay, again, me and my son both use this machine, but we both have our own tips. So he has his and I have mine. Put that baby on there. It spins. So if I'm up here and I'm going around, I can then spin it and go on the inside and come back around. And I just have to turn it. I don't have to. I can move it too, but I don't have to be like upside down with it. You know what I'm saying? Like, keep it simple. Here in the front, follow that gone line. Come back around on the inside. Done. It shouldn't take you more than a minute to do your whole mouth. I always tell patients, keep going until all the water in the water reservoir is gone. So if that means you go around 2 or 3 times in your mouth, that's okay. It just means it's more clean. It's okay. You're not going to spend a lot of time in the bathroom, all right? This does not replace flossing, because where you hear the floss snap, it doesn't get that. Where the two teeth touch, it does not get. It'll get everything underneath. It'll get everything down underneath the gums. So this is my tooth. This is the gum tissue. It gets down into this pocket, flushes all the stuff out from here, okay? But it does not get where these two touch right here. And this right here is called a contact. This is where most cavities start. That's why normally if you have a cavity on one tooth, you probably have one on the tooth that it's touching. All right? So, you know, when you go to the dental office and they say, hey, you have 3 cavities now, it's because those teeth are touching. Those teeth touch. And keep in mind, when you're flossing, if you're using something like this, you are moving it from one to another, to another, to another. I'm not really a fan of these. This is great for kids. This is great for adults to do or use it on kids. But for adults, unless it's for a quick, I got something stuck in there, toss it out. Toss it out. If you have any questions, please I am learning things every day, so there may be some other products out there that I have not tried or that I don't know about as of yet. Okay, but these are normally the ones that I recommend to patients. It's very rare when I recommend one of these. I am more quick to recommend a water pick, and I'll probably recommend a stimulator. Well, you know, every dental professional is different. They're going to recommend different things, and it really depends on the patient and what's going on in their mouth. So what works for one person may not work for everybody, but I hope that I was able to explain everything a little bit more so that at least you can understand why you're being recommended something different than maybe your spouses or your kids are. Thank you so much for watching. You guys have a great day.